Good morning, everyone. I am Dr. Melissa Joyce P. Rambuanga, Publicity Committee Chair of Ako Para sa Bata 2020. The 12th Ako Para sa Bata is presented by the Child Protection Network Foundation and UNICEF. Our theme for this year is Care of the Child Against Violence in the Time of Disease. If you are not yet following us, please do follow the Ako Para sa Bata social media accounts. Tag or mention Ako Para sa Bata and make sure to include the hashtag COVID-APSB 2020 in your posts. Again, it's hashtag COVID-APSB 2020. Let me introduce you to the moderator of the session entitled Mind Matters, Adolescent Mental Health 101. She is a consultant and residency training committee member of the Medical Center Manila and a consultant of the Mary Child's General Hospital, a diplomate of the Philippine Pediatric Society, Incorporated, and member of the Society of Adolescent Medicine of the Philippines, Incorporated, and also a diplomate of the Philippine Society of Adolescent Medicine Specialists, Incorporated. Our dear Ako Para sa Bata community, let us all welcome the moderator of this session and my batchmate, Dr. Margaret May C. Mahanyo. Over to you, Marga.
Thank you, Mel. Good morning to everybody. Welcome to Webinar 16, Mind Matters, Adolescent Mental Health 101. To those who have joined the previous Ako Para sa Bata webinars, welcome back. For the first-timers, welcome to the Ako Para sa Bata community. On behalf of the Child Protection Network Foundation and also from UNICEF, we are deeply grateful for your continued support. Ako, tayo, para sa bata. This is the 16th webinar of Ako Para sa Bata 2020. There are only 7 webinars left. If there is anything that we have learned from this COVID pandemic, it is the importance of mental health. We have experienced a disruption of daily routines, quarantine restrictions, fear of infection, loss of jobs, and loss of colleagues and even loved ones. It is understandable how one can slide into anxiety and depression in this continuing uncertainty. While it has been hard for all of us, the population that is most vulnerable to these changes are the adolescents. They are at a stage when social interaction is a key ingredient to a healthy development. The pandemic has kept them away from school and from their friends who are extremely important to them. Without these social supports, it is hard for them to traverse these uncertain times. Hence, they are more prone to mental health concerns. Now, in this session, we aim to explain, in the context of psychosocial development, why adolescents are vulnerable to the impact of the current pandemic. Also, to differentiate the facts from common fallacies related to mental illness. And lastly, to describe the practical approaches in promoting the emotional well-being and building resilience among adolescents. I will now introduce to you our first speaker. She is an active consultant of the Department of Pediatrics of the Perpetual Health Medical Center and an assistant professor of the Junelta Foundation School of Medicine in the University of Perpetual Health Rizal. She was a technical writer of the Clinical Practice Guidelines for the Management and Prevention of Adult Community-Acquired Pneumonia of the Department of Health and the University of the Philippines. She is also a researcher of the health-seeking and sexual health behavior of adolescents in Tondo of the Medicine Sans Fronteras and Protect Chatbox app of UP and Likhaan Center for Women's Health, among others, to discuss Is It All in the Mind? Facts and Fallacies about Mental Illness. Let's welcome my colleague and dear friend, Dr. Natasha Ann Esteban Ipac.
Good morning. Good morning, everyone. For what? Okay, so thank you very much for the organizing committee for the privilege to share this talk and really an honor to be here to be with everyone. Thank you very much. Now, before I start and answer if it's actually all in the mind, I want to first know everyone. What's actually in your mind? Okay, when you hear adolescents or teens, can you please type in our chat box an adjective that you think would best describe an adolescent or teen? Okay, now some of the usual words associated with them are as seen here, moody, active. I love it, it's colorful. Okay, aggressive, stressful. Now, but let's see if we can actually explain why they're actually like that, especially at a time like this during the pandemic. Now, let's see what's in their mind. Okay, wow. What we can see is that the biggest part of their brain is the birds and the bees lobe, with not just a rebellion center, but an even bigger super turbo rebellion center. Now, of course, this is just a graphical picture of what's really inside their minds. But again, let's find out together. So for this morning, here are my objectives. So first is to define adolescence and why it's special, to describe the adolescent brain development and why it's totally different from the adult brain development, and just to differentiate between adolescent mental health and fallacies. And again, we'll try to make this a bit more interactive. So I would need your help. And if you can type in the chat box if you think some of my statements are a fake or a fact. Don't worry, I'll ask them and then I'll give you time to answer. Okay. But first off, let's go to definition. Okay. Adolescence is actually a critical transition between childhood and adulthood. So it's a period of development characterized by dramatic physical, cognitive, emotional, and psychosocial changes. So true enough, adolescents may actually be moody, confused, reckless, defiant, irritable. But let's go to our first statement. Teens act the way they do because of raging hormones brought about by puberty. Is it a fake or a fact? Can you type in your answer if you think that's a fake or a fact? Okay, most of you are answering fact. Let's see. Now, adolescence is actually, it includes a cascade of hormonal changes that lead to reproductive maturity and stimulate numerous structural and functional changes in the brain. Your sex hormones fuel sexual striving, sensitivity to physical attractiveness, and even interest in romantic partners. But it actually also has an impact on the neural circuits that regulate their emotions, their moods, their aggression, and risk-taking behavior. So it actually is a fact. But more important, actually, than these hormones are the developmental changes that occur in an adolescent brain. So for my next statement, brain is fully mature by the time they are of legal age, around 18 years old. Is it a fake or a fact? Okay, most of you are saying fact, a fake with a few fact. Okay, now the brain, it's true actually that the brain reaches the biggest size during early adolescence, but it's actually more than the size of the brain. It's actually what's going on inside the brain that's more important, because the brain continues to mature even after it's done growing. So if you think that just because these teens are of legal age or since that they can vote, they can get married and even decide for themselves, their brains are not yet fully mature. So it's actually a fake, just as most of you mentioned, that their brain is fully mature by legal age. But they can actually still act on impulse, they can still misinterpret social cues, and even engage in risk-taking behaviors. And studies have found that it actually is around the mid-20s, around 25 years old, that the brain is fully mature. But what does this mean for us? Now, this is actually what's really going on inside their brain. Now, I don't want to scare you nor even attempt to discuss the intricacies of our magnificent brain, but just to summarize this picture. It's just that they found out that the adult and teen brains work differently. How? Let me focus you on just two parts of the brain here. So we have the amygdala, part of our limbic system, which I'll label as A, which is in charge of our emotions and impulse. While we also have your prefrontal cortex, which I'll be labeling B, which is the one in charge of executive functioning. So that's in charge of your planning, judgment, and reasoning. And remember that the teen brain is still developing. So they are actually logically capable of understanding and doing a lot of adult things, but the connection between the emotional and the rational part of the brain are still developing, and their development is not at the same rate. So the emotional brain developing ahead than the rational brain, such that teens process information with the amygdala, the emotional part, while adults actually think with the prefrontal cortex. So hence are not thinking as much as they're actually feeling. Huh? So what we have is a sexually mature body with a relatively immature set of neurobehavioral systems for control and regulation. So to have a better grasp of this, in an analogy, it's like turbocharging the engine of a fully mature car with an unskilled driver whose navigational skills are yet to be developed. Now what happens is that the limbic system or the amygdala, here A, acts as the accelerator propelling the car along the road, while B, or the prefrontal cortex, acts as the car's brakes and steering wheel. Remember, they do not develop simultaneously. So there's actually a gap between the development of the accelerator and the brakes or steering wheel, such that there will be a time wherein this turbocharged car is always on accelerator mode. So even if there's actually troubles ahead, be it problems, issues, or risk-taking behaviors, all they can do is press on the accelerator and move forward. So it's actually not until their brakes and their their GPS or their navigational skills are fully developed will they only be able to drive that car perfectly. So being a responsible adult requires developing self-control over behavior and emotions to appropriately inhibit and modify our behaviors despite having these strong emotions. Now, on top of all this going on inside the brain, they're also drastically developing and changing in other aspects too. So they also have their psychosocial development. So they have these tasks to go through. First is the development and acceptance of body image. Remember that physical changes are also ongoing. So for girls, breasts are developing and they're starting to have menstruation. For boys, hair are starting to grow everywhere. Pubic hair, chest hair, armpit hair, their beards, and even add to that the appearance of pimples. So that's already an issue for them. Next is their struggle for independence. As they are growing up, they are trying to establish that they're an adult so that they can actually stand up by themselves. This is the time of increasing autonomy. That's why they're really trying to move away from the parents and the family. Now, this is actually the challenging part for parents since this would really manifest as teens being resistant or even rebellious to authority when in fact they just want to exercise their independence. Now, since they're trying to be independent away from the family, this is also the time where peer group involvement is very important and influential in their lives. Um, Peer group involvement, they start to adapt to peer codes and then to their lifestyle. And lastly, practically summing up everything about what's going on during adolescence is that they're just literally struggling to find and develop their own identity. You want to know their vocational goals, their ego, their moral identity. So in short, they're just asking, who am I and what can I be? So truly, adolescence is a period of critical and dramatic changes, and it can be really very stressful for them. So going on to our next statement. Teens can be stressed, but they're too young to actually experience mental health. Is it a fake or a fact? Okay, still a mix of fake and fact answers. Okay, so I would just like to go back to our car analogy. Okay, so here we have the teen going through this physical, cognitive, emotional, and psychosocial development. Right? So the teen is already having an internal struggle with how to control the car while having to learn to actually drive and maneuver it. At the same time, trying to navigate it in the road, turning left, turning right, turning around, or whatever. Right? But remember, in the road, there are also other cars, other people such as family, friends, the school, community, or even a stranger who can affect and will affect how he or she will try to navigate along the road. And alongside all these roads are the road signs, stoplights, humps, potholes, and even different streets, paths, highways that they have to take while actually trying to identify where they really finally want to go and what to become. Now, teenagers go through many challenges, many changes in this short period of time. This also happens while teenage brains are still maturing, that any or a combination of these stresses can affect them in their maturation process. So, as long as the brain is still information and is still developing, things can go wrong in many ways, and some of them involve the onset of mental health disorders. Add to this the extra stress of this pandemic. COVID brought about the closure of schools, disruption of their schedule, not seeing and playing with their friends, which, as we mentioned, are very important during this stage. Now, all these have an effect on their developing mind. So, my point truly, adolescence can be a risky period for mental health problems, and adolescents are very vulnerable to mental health issues. And true enough, statistics wise, according to WHO, worldwide mental health conditions actually account for 16% of the global burden of disease and injury in people aged 10 to 19 years old. And half of all mental health conditions start by 14 years, and three-quarters of which by when they are in their mid-20s, just when their brains are fully developed. So for many adults who have mental disorders, symptoms were actually present during childhood and adolescence, but were often not recognized and addressed. Also, globally, depression is one of the leading causes of illness and disability among adolescents. And sadly, suicide is the third leading cause of death in 15 to 19 years old. Now, these neuropsychiatric conditions are major causes of disability in young people. And if untreated, these conditions severely influence their development, their educational attainments, and their potential to live fulfilling and productive lives. So teens, even though they seem young, can actually experience mental health problems too, and we cannot overemphasize the importance of mental health among the youth. So next statement. Teens have a weak personality, that's why they have mental illness. Is it a fake or a fact? Okay, majority of you are answering fake. Okay, which is true. Okay, it's nobody's fault. Okay, it's actually still an argument of nature versus nurture, and mental illness are thought to be caused by a variety of genetic and environmental factors, but most importantly, it is multifactorial. Okay, so there are a lot of factors that can make an adolescent vulnerable to mental health problems. So under biologic, we have your genetics. Mental illness is more common in people whose blood relatives also have mental illness. However, this does not mean that it is inevitable for individuals with family history. It simply means that such people may be more vulnerable and should take steps to reduce the risk, such as getting evaluation and treatment at the first sign of mental illness. Next is brain injuries. So for those who have had head trauma or even those who had brain tumors are also at risk. Another is prenatal damage, which includes exposure before birth to either environmental stressors, inflammatory conditions, toxins, alcohol, or drugs, while inside the womb may also be related or linked to mental illness. And lastly is the brain chemistry. Now, I'll discuss this a bit more later, but we have what you call the neurotransmitters. These are naturally occurring brain chemicals that carry signals to other parts of your brain and body. When there is an imbalance in these neurotransmitters, these lead to emotional disorders. Aside from biologic, we also have a lot of environmental factors that can cause mental health among teens. So you have your substance use, be it alcohol, tobacco, or drugs, trauma, emotional, sexual, or physical abuse, even neglect, or just by being victim or even witnessing a violence. Bullying or cyberbullying, unsafe living conditions, including dysfunctional home environment, demands at school at work, which is very common nowadays, cultural or social expectations, so the value connected to being thin or the sexual identity are actually factors, loss or grief, so these includes death, not just of loved ones, but also other people or even their pets, or even breakups. Can also have feelings of inadequacy when they have low self-esteem due to humiliation, failures, or discrimination. If they have health problems or those teens with chronic illnesses, natural disasters and accidents. So again, this COVID pandemic is by itself a risk factor already, and even poverty. Now, all these events increase the risk of mental health disorders, but each have different effects on different individuals because again, mental health concerns are usually multifactorial. Okay? So mental health illness is not caused by a weakness or a character flaw. Next, irritability, boredom, and anger are signs of mental health issues. Is it a fake or a fact? Okay. Now, it's still a mix of fake and fact, but most of you are saying it's a fact. Okay? Now, adolescents may actually mask their feelings of sadness with irritability, hostility, and angry outbursts. So they are grumpy and can easily get frustrated or bored. And these symptoms are usually more common presentations than feelings of sadness or loss of energy seen among adults who present with depression. So we do need to watch out for these signs and symptoms as well. So if they're actually, or if they have extreme feelings of sadness, which can include crying spells for no apparent reason, for those who present with extreme sensitivity to criticism, so feelings of worthlessness, rejection, and failure. If you note that there are changes in eating and sleeping habits, if there are persistent chronic pains, such as abdominal pain or headache that have been consulted, yet no organic cause can really be identified. Now, take note that it's normal for teens to be sad for a couple of days, but if you see a significant mood or behavioral changes that is more than 2 weeks, it could already mean something else is going on. Okay? But what are some of the red flags that we need to watch out for? So first is if they are not interested with people or if they withdraw from people. Okay? If they would present with frequent absences or drop in school performance, if they begin to have less attention to personal hygiene or their appearance, if they are engaging in high risk behaviors such as substance use, engaging in sexual activities, shoplifting, um, having physical fights, or running away. Okay? If they also have suicidal thoughts, or if they have preoccupation with death, or they would start giving away their prized possession, if they would present with self-harm, such as cutting, burning, or even those who have excessive piercing or tattoos. Now, these are the things that we do need to watch out for, and we need urgent referral. Hmm. Next statement. Talking about suicide will trigger suicidal ideation or suicidal thoughts. Is it a fake or a fact? Okay, it's still a mix, but most of you are answering it's a fact. Okay. Actually, studies and even meta-analysis have shown that you cannot put the idea of suicide in someone's head. Okay? You may actually be preventing it. How you may say? So first, it actually shows that you care and you're there to help. Remember that people start thinking of suicide when they feel hopeless and they feel alone in their struggle and when they don't see any way out. So telling them that they're not alone shows them actually someone cares. Okay? Next, it also helps us determine if they're in immediate danger and in need of assistance so we can act on it the soonest. But of course, it doesn't mean that we should go ask every adolescent that we see, are you suicidal, are you suicidal, are you suicidal? Okay? Because we need to talk about suicide responsibly. Okay? Talking about suicide is difficult and uncomfortable, but it's very important. It's not your job to fix all of the teens' problems all at once, but just provide a caring and non-judgmental space for them to share their feelings. And make sure to listen, as in listen and hear them out. Okay? When they say that they're having thoughts of hurting themselves, believe them. Okay? They're trying to tell you something and that they need help. Some teens may make desperate statements because of the stress and emotional pain that they're going through. Sometimes they will talk about dying, but don't really intend to die. But don't take it as though they're joking or they're just attention seeking. They're trying to communicate something and it's their call for distress. So according to the American Society of Suicide Prevention, most people who die by suicide tell someone they plan to hurt themselves before they take their lives. So please, please listen. Okay? Aside from that, offer help and seek for help. So that's why we actually have your mental health professionals, even us pediatricians or among social workers, you're also here to help. Okay? And remember that you should never promise to keep their suicide a secret. Okay? It's never confidential. You can call their doctor, a suicide prevention hotline, hospital, or you can bring them to the emergency room if needed, but do not leave them alone. They may be mad at you or they may even hate you. but it's better for them to be mad at you than to be dead. Okay? They will eventually thank you for it. So just remind them that you're there to support them and help in any and every way that you can. Okay? Next, patients on antidepressants become dependent to the drug. Is it a fake or a fact? Can I see your answers? Okay, still a mix of fake and fact, but most of you are saying fake. Okay, now, first and foremost, we must understand that mental illness can be treated. Now, as much as 85% of people respond to treatment. But how do we treat it? So we usually have biomedical approach, which includes psychopharmacology or medications, as well as electroconvulsive therapy and even psychosurgery. Then we also have your psychotherapy or your talk therapy. But the most effective, at least for most of the severe mental health concerns, is the combination of two. So it's usually medication plus psychotherapy. But for us for us to appreciate works of medications, we must understand how it actually works, right? Remember, I told you about the brain chemistry earlier. We have what we call the neurotransmitters. So these are the naturally occurring brain chemicals that causes emotional disorders. Now, each neurotransmitter is in charge of a certain neural pathway that would affect our mood and behavior. And just to be more graphic, so this is a magnification of one of the million neurons inside our brains where neurotransmitters are supposed to be working. So ideally, one little guy will throw a neurotransmitter to the postsynaptic membrane receptor here represented by the hand. Now, if the neural networks involving these chemicals are actually impaired, meaning any of these guys are not throwing enough out, or this guy is hoarding the neurotransmitters, or on the other hand, in the postsynaptic side, one hand cannot actually reach for the neurotransmitter or cannot let go of a neurotransmitter, there will be an imbalance. And that imbalance is what causes the symptoms of mental illness. Remember that depression is a biologic and medical illness. Now, not until we can actually go inside our head and demand each and every neuron or neurotransmitter to balance things out, we do need medications to help sort it out. Now, individual clinical trials and even systematic reviews still support the use of antidepressants in adolescents with depressions because antidepressants work. The longer we allow the imbalance to happen, the greater it will affect the teen's life. And the earlier treatment is started, the more effective it can be and even help prevent more severe lasting problems. But on the other hand, we also have to understand that antidepressants are not magic pills, that once your teen takes it today, they will become happy and well by tomorrow. That's where the problem usually comes and why parents feel their teens are dependent on it. It would usually really take weeks and months for it to work. And in some instances, when they would feel that the teens are usually improving, they would already stop the medication, which is usually too soon. So depression will come back again, making the parents feel that their child are dependent on the drug. Now, medication should be maintained for about 6 to 12 months after symptoms have resolved. So it really is a long time. But it's actually a fake that they become dependent or addicted to it. But just another concern, we do use a personalized treatment for our patients with mental health concerns. So they need to have their own treatment plan based on their need and their medical situation, be it just medications, be it just psychotherapy, or both, or others. Right? Now, it's really important to follow the doctor's directions for taking the medicine at an adequate dose and over an extended period of time for it to work. And of course, we cannot stop it abruptly since there may be some withdrawal symptoms as well. Now, lastly, seeing a psych is for crazy people. Is it a fake or a fact? Okay, at least most of your answers are fake, and I do hope you know that it is the case because mental health problems are unlikely to get better on their own, nor will they just vanish. So most of the time, as I mentioned earlier, combination would be better. But again, treatment is based on person's individual needs and medical situation. Hence, it's really done under a mental health professional care, which are the psych people. So we do need psychiatric evaluation prior to starting treatment and to monitor our teens. So let's just do another analogy. When you feel that there's a mass on your neck, you either go to ENT or surgeon to check and rule out that it's not cancer, right? In the same manner, if there's something bothering you about mental health, you must also seek care from psych people, right? And you don't need to have a neck mass or cancer to go to your doctor, right? In the same manner, we don't really need to be suffering from mental health issues just to go see a psych. No? Psych is not just for crazy people. Okay, so if you need clarity in some areas of your life, or you just want to work through some emotions or traumatic experiences, or you just want to learn some coping skills to cope with a difficult situation, you can actually come go see them. Now, we do need our mental health professional care. So it actually is, in fact, that the people who see or consult psych are not crazy. They're actually those who seek to better themselves. And those who think otherwise are the ones who's probably crazy. Right? Now, when teens have a cast or stitches because of an accident, they're really very excited to show it. Even vomiting, they would post or tweet about it. But when it comes to mental health concerns, it changes, right? Because we have to admit it, talking about mental health is still treated as a taboo. It's very difficult to open up or just talk about it. And why? They're scared to be judged and misunderstood, scared that others will think that they're crazy or weak or just a lesser person. And they're scared that it will not just affect their lives, but also their families' lives. So, stigma and lack of understanding are the main reasons mental illnesses and suicide remain topics we avoid. So, let's just break the stigma. So, I hope that by knowing the difference between the facts and fakes will help you understand in doing so. People suffering from mental illness should be treated just like any illness. It should be normalized as any other disease. Social pressure should actually turn out to be a social support, and we should all be adjusting our minds. So, in summary, we actually discussed that adolescence is a crucial period of growth and development, and mental health is an important part of the overall health of these teens. Adolescents are vulnerable to different mental health conditions, and being in this pandemic adds a certain risk factor for the teens' mental health. But these can actually be prevented and supported. We must learn also the basic truth about adolescent mental health, and it's very important to differentiate between fallacies and facts, and of course, to break the stigma. Now, just to conclude this lecture, let me just go back to my first slide to answer the very question that started it all. So, is it actually all just in their mind? Actually, no, it's not just in their mind. Okay? And I hope that we do mind the teen mind. Thank you very much for your kind attention and have a good day.
Parang bukid na lilipad-ipad sa gitna ng daan.
Okay. Thank you, Dr. Natasha, for the slides, for your presentation, for citing examples that we can all relate to, and also for the interactive session. Now, the accurate information you have provided with us, correcting all common misconceptions, will really help us deal with the stigma of mental illness. And also, it will help us to encourage us to develop more help-seeking behavior amongst our teens. Now, I will introduce the next speaker. The next speaker is an associate professor of the UP College of Medicine and also a training officer of the Division of Adolescent Medicine, Department of Pediatrics, UP-PGH. She's a board member of the Society of Adolescent Medicine of the Philippines Incorporated and also a member of the Philippine Society of Adolescent Medicine Specialists. A mother of 3 beautiful and fully breastfed children, here to discuss changing minds, how to support the well-being and promote resilience among teens. Let us welcome my mentor and friend, Dr. Vanessa Maria F. Torres Dixon.
Good morning, everyone. Thank you so much, Marga, for your kind words. And thank you so much to all the Ako Para sa Bata organizers for having the Adolescent Medicine Division to be here to talk about something very relevant to one of the vulnerable groups in our country and in the world, our dear adolescents. So these are our two learning objectives for this morning to describe the role of social workers in supporting the mental well-being of adolescents and to explain some strategies on how to build resilience. And this is going to be our outline for the next 20 minutes. Social workers are highly trained professionals working to improve the quality of life and well-being of other people. They are dedicated to the pursuit of social justice, and they have an extensive knowledge of human behavior and development. Because of the nature of their work, they possess compassion, a passion or love for helping others, strong interpersonal and problem-solving skills, and the need to have good listening and organizational skills. Social workers play various roles, and some are as follows. I know that most of us here are social workers. So what do? They reach out to those in need. They make a needs assessment and implement a plan of action. They help people adjust to major life changes, like in our current COVID-19 pandemic situation. They respond to crisis situations and connect people with important resources and support, especially, this is very important, especially in terms of mental health, and they evaluate social services and support programs, among others. So how do social workers respond to mental health concerns? In the community, they undergo capacity building to become, hopefully, mental health social workers. There is a need to develop training manuals for them to know more how to initially handle such cases and to refer these individuals to appropriate services. In this school, what is recommended is to establish a curriculum-based mental health intervention since such promote healthy functioning of teens and provide access to social workers through existing mental health services to foster a safe school environment. This is more of proactive, preventive, and holistic approach to mental health. We want to overcome the barriers by improving mental health literacy and reducing mental health stigma among teenagers. In the hospital, such as in PGH, the social workers may refer to appropriate services such as adolescent medicine and psychiatry. We work hand in hand or use the interdisciplinary approach. So what is mental health? According to Section 4 of Republic Act 11036 or the Mental Health Act, mental health refers to a state of well-being in which the individual realizes one's own abilities and potentials, copes adequately with the normal stresses of life, displays resilience in the face of extreme life events, works productively and fruitfully, and is able to make a positive contribution to the community. The next two slides show some of the provisions of the Mental Health Act, such as in Section 2, the state recognizes the right to mental health of all Filipinos. In Section 4, there are some definition of terms wherein a social worker is also considered a mental health professional. There are provisions that emphasize the need for mental health services in the community as well as in the hospital setting, the need for public awareness on the protection and promotion of mental health, and also the need to promote mental health in the schools and in the workplace. Another important provision is the capacity building of our mental health, of our healthcare providers. I borrowed this beautiful slide from Dr. David Bennett, one of the renowned and highly respected adolescent medicine specialists, practicing in Australia when he lectured to us in 2018 in our last SAMPI convention. And I quote, "Children with high levels of social and emotional well-being are loved and safe, with positive family relationships, connections, and support networks. They have a strong sense of identity and self-esteem and are resilient to setbacks. Positive family relationships and supportive neighborhoods can protect children from some of the impacts of disadvantage. Now, I want you to reminisce your adolescent days, and these are my questions. What were the things that most concerned you when you were an adolescent? Who were the people you trust and whom you can turn to for support and guidance? And what made you happy as an adolescent? You can type your answers in the chat box. Okay, so we now move on to a big term called resilience. I want to remind everyone who is listening now that this talk is not only for doctors or only for social workers. It's actually for everyone who live with or work with adolescents, no? So those parents out there or those teachers, I hope that you will be able to get something from this lecture. According to Dr. Ginsberg, resilience is the capacity to rise above difficult circumstances, allowing our children to exist in a less than perfect world while moving forward with optimism and confidence. And young people will be resilient when the important adults in their lives believe in them unconditionally and hold them to high expectations. I think these two statements are overwhelming and really beautiful that we should remember when dealing with our adolescents or children. Resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, whether it be financial, in terms of relationship, or in terms of health. The term resilience came from the Latin word resilere, which means to spring back. It means bouncing back from difficult experiences. I want to emphasize that resilience is not a trait that people either have or do not have. It involves behaviors, thoughts, and actions that people can actually learn and develop in anyone. Resilience can actually be taught and encouraged, especially among our children and adolescents. And I quote Wendy Mogul when she said that, teach them to be resilient, self-reliant, and courageous. If you rush to rescue children from distress, they don't get the opportunity to learn that they can suffer and recover on their own. This is important for parents to know because sometimes we pamper our children too much or give them everything they want, and so they don't experience being turned down and gradually being able to recover without getting this particular material thing. There are various factors involved in developing resilience. The primary factor is having caring and supportive relationships within and outside the family. At least having one caring adult would be enough to make an adolescent resilient. It doesn't have to be one of the parents. It could be an older sibling, it could be a grandparent or a teacher. Resilience definitely requires external support systems. Relationships that create love and trust, provide role models, and offer encouragement and reassurance help bolster a person's resilience. Having strong parent-child or carer-child relationships is crucial. They promote emotional, social, cognitive development, emotional resilience, and healthy lifestyles. They are also associated with increased resilience against a range of difficulties, including mental illness. This slide shows the different parenting styles, and it is evident here that what is highly recommended is that of an authoritative parenting style that is high in warmth and high in regulation. No? So that is what we recommend, an authoritative parenting style, as compared to an authoritarian parenting style that is low in warmth and high in regulation. So how do we describe authoritative parents? Involved and responsive. They are firm and strict, demanding of maturity of their children. They foster and encourage psychological autonomy. These parents develop rules but are affectionate. So in terms of practical application, these authoritative parents do the following. They plan ahead and make rules clear. And it would be good if you will involve your teens in making the rules so that there is higher likelihood that they will follow, since they were the ones who helped in making these rules. No, and you did not just impose these rules on them. Number two, that the rules are clear and there are immediate consequences for unwanted behavior. No, the consequences should be immediate because we want them to understand what bad behavior they did that warranted the consequence. Number three, be consistent as much as possible. Number four, handle rule breaking calmly. And number five, catch them doing something good or something right and be precise with praise. When we say be precise with praise, it means that you have to be specific. You don't just say na, Anna, you were very good, or Anna, you did a great job. You have to be specific, as in, Anna, you were good because even if you are not feeling well, you still went to class and did your best to participate in the discussion. So essentially, these parents show love and accept their children as both special and ordinary. They expect respect and they encourage self-reliance. I just want to go back to the slide. Studies by Eisenberg have found that eating meals as a family benefits young people above and beyond their general sense of connectedness to family members. The frequency of family meals is inversely associated with alcohol, tobacco, and marijuana use, depressive symptoms, and suicide involvement. So that's how important having family meals is for our children. This slide shows the other factors that contribute in developing resilience. We have the capacity to make realistic plans and to take steps to carry them out, having a positive self-regard and confidence in your strengths and abilities, good skills in communication and problem solving, and the capacity to manage strong emotions and impulses. All of these factors are things that people can develop in themselves, especially among our adolescents. The ecological view of resilience includes the protective factors influencing resilience. First are the individual, like autonomy, self-esteem, and a positive social orientation. Second is the family cohesion by having warmth, less discord, and having caring adults at home. And third are the external support systems that encourage and reinforce the church, the school, and the community. Resilient children have various strengths, which, when coupled with environmental or external strengths, can be described as protective factors. Okay, now we go through the different strategies in building resilience. My source here is the American Psychological Association, or APA. So let's go through our list, and there are 12 in the list. I want to emphasize that developing resilience is actually a personal journey. People do not react to all the traumatic experiences in the same way. An approach to building resilience that works for me, for example, may not work for another person, and people use varying strategies in order to cope. Okay, the first one is to provide a safe and secure home where adolescents are loved. It is crucial to make connections. Good relationships with close family members, friends, or other significant people are important. Accepting help and support from those who care about you and will listen to you strengthens resilience. Some people find that being active in socio-civic or religious groups provides social support and can also help with rekindling that hope. Assisting others in their time of need provides benefit not only to the one being cared for, but also to the one who is helping. Ultimately, happy teenagers are teenagers with warm relationships. Second, be a role model for healthy behaviors. Teach by example, like how to deal with stress, how to do problem solving, how to do conflict resolution. Children and adolescents are greatly influenced by their parents of how you brought them up. So, for example, they are confronted with a problem and they would think na, nung naalala ko, nung aking parents ay nagkaroon ng ganitong problema, ganito sila nag-react. So, ako rin, ganito rin ako mag-react kasi pinalaki ako na sa aking palagay, ganito ang tamang reaction o pag-solve ng ganitong problema. Okay? So, number 3, learn to listen and spend time with your adolescents. Being there for them, being available, offering them your listening ears with no judgment and not just always lecturing on them, and giving your shoulders to cry on will definitely make your adolescents feel loved unconditionally no matter what. Providing them with material things is actually not the gauge of love. Fourth, teach children and adolescents to change how they interpret and respond to stressful events. We have to reframe our mind on how we look at a problem. It is not something that is insurmountable, but something that can be resolved. You cannot change the fact that highly stressful events do happen, but you can change how you interpret and respond to these events. Try looking beyond the present to how future circumstances may be a little better. Note any subtle ways in which you might already feel somewhat better as you deal with difficult situations. Fifth, accept that change is a part of living. Certain goals may no longer be attainable as a result of changes in situations, such as what happened during the pandemic. Classes were suddenly stopped, field trips were canceled, there were no more graduations, or this were just done virtually, and they were not able to say goodbye to their teachers, to their friends, and to their classmates. Accepting circumstances that cannot be changed can help us focus on circumstances that we can actually alter. Okay, sixth, develop realistic goals and work towards achieving them. Even if the task or goal seems so far away and would entail so much steps towards its achievement, encourage them to do something regularly, even if it seems like a small accomplishment only. It will eventually lead towards the achievement of their goals. Instead of focusing on tasks that seem unachievable, let them ask themselves, what is one thing I know that I can accomplish today that helps me move toward the direction I want to go? Then you celebrate with them their little victories for the day by complimenting them and recognizing their untiring efforts. Seventh, persevere when problems arise. Encourage your adolescents to carry on even when problems arise along the way, and never to give up. Help them to persevere, face their problems boldly, even if this is easier said than done, and not to run away from these problems. Okay? Eighth, allow them to have opportunities to make decisions and have some control. As parents, of course, we only wish what is good for them, but we need to realize that if we truly love them, we cannot keep them in a vacuum or in a bubble where they will be protected. We need to respect our adolescents and provide them with the opportunities to grow, to make hopefully wise decisions with our guidance, and for them to have some control. This will improve their problem-solving skills and strengthen them as a person as well. Ninth, nurture your adolescent self-worth and maintain a hopeful outlook. Catch them doing good. Let's avoid just talking to them or reprimanding them when they do bad. Praise them when they give their best in their studies, when they help in household chores, and when they show kindness. Developing confidence in your adolescent's ability to solve problems helps build resilience. An optimistic outlook enables them to expect that good things will surely happen in their life. Help them visualize what they want rather than worry about what they fear. As parents or advocates of adolescents, be a source of encouragement and hope for your adolescents. The parents should be the number one cheerleaders. 10th, keep things in perspective. Even when the adolescents are facing very painful events, help them to try to consider the stressful situation in a broader context. Enable them to realize that this such situation too shall pass, like this pandemic. Many people who have experienced hardships have reported better relationships, a greater sense of strength, even while feeling vulnerable, an increased sense of self-worth, a more developed spirituality, and a heightened appreciation for life. 11th, do self-care. Teach adolescents to take care of themselves by eating nutritious foods, having enough sleep, by relaxing, engaging in things that make them happy, spending time with people they trust, by doing physical activities like exercising or dancing Zumba, and setting small goals and making simple steps to achieve these goals. Taking care of themselves helps to keep their mind and body primed to deal with situations that require resilience. 12th and the last in the list is to do meditation and spiritual practices. Some people find journaling or writing about their feelings, praying, meditating, and making simple mindfulness exercises such as deep breathing very helpful and enables them to restore their sense of hope. Studies have found that those who believe in a higher being and look at life as more than what this world offers to be more resilient. The key is to find ways that are likely to work well for these adolescents as part of their own personal strategy for fostering resilience. I want to quote Dr. Bloom when he said, "Building resilience is a never-ending upward spiraling of coping with and taking charge of problems, solving them one at a time, and transforming failures into strategies that can be used to cope with and take charge of the next problem." These are the contact details of some of the hospitals or services that provide mental health support, such as in the Philippine General Hospital, our parents or our adolescents can contact the hotline, which is 155-200. This is actually a free call even with your cell phone. An operator will help them make an appointment with the needed specialty. The doctor will be the one to call the patient or the parent so that the patients don't have to shell out money for the consult. We have the UPPGH Division of Adolescent Medicine Facebook page wherein our adolescents can leave a question, whether medical or psychosocial. Our fellow doctor will be replying to them, but ultimately our fellow doctor will still refer them or direct them towards the PGH hotline of 155-200 so that they will have more time to talk with the doctors. We have also the Natasha Goldborn Foundation 24/7 Hoopline, which provides 24/7 emotional support for those needing one, and these are the numbers. We also have the National Center for Mental Health e-consultation every Monday, Wednesday, Friday from 9 a.m. to 3 p.m. And this is the link that they have to go through as flashed in the screen. Okay, to summarize, social workers play an important role in supporting the mental well-being of adolescents by pointing them to appropriate services. Resilience is the process of adapting well during stressful situations and being able to bounce back. It is something that can be taught, can be learned, encouraged, and developed, especially among our children and adolescents. And ultimately, having caring and supportive relationships plays a very essential role in building resilience. These are the references I used. And thank you very much for your kind attention. Before I close, I want to share this quote. The evidence indicates that meaningful and engaged lives are more important than pleasurable experiences in determining well-being. Magandang umaga po and maraming salamat.
Thank you, Dr. Vanessa. So resilience is a new term for some of us, and it's something that or for some other people, it's something we have relearned more about today. thank you, Dr. Vanessa, for sharing tips and also citing practical examples to help our teens bounce back from life's challenges. So I will read the questions. Please feel free to type in your answers. Well, number one, how have you been feeling during these past months of the COVID pandemic? I am okay most of the time, not okay most of the time, okay and not okay at times. I will repeat. How have you been feeling during these past months of the pandemic? Okay most of the time, not okay most of the time, okay and not okay most of the time. So for those in Facebook, please click your answer. For those in Facebook Live, just please type in your answer in the comment section. So feel free to give it type in your answer to receive the merchandise from Ako Para sa Bata. So the winner here is okay most of the time, followed by okay and not okay most of the time, and very few with not okay most of the time. So for the next question, poll number 6, do you know of a teenager, this can be a client, a relative, or a friend who has a mental health concern? Yes, no, not sure. So I will repeat the question again. Do you know of a teenager, this can be a client, a relative, or a friend who has a mental health concern? So if the answer is your answer is yes, please click yes. If it's no, please click no. If it's not sure, you can just click not sure. And if you're on Facebook Live, just type in your answer in the comments section. So do you know of any teenagers who have been feeling these things? We would love to hear from you, so please share with us your answer. So the top answer here is yes, followed by 71%, and we have low scores with no and not sure. Here is our next question. Will you be willing to ask about suicide? So here are your choices. Yes, if it helps. No, I'm scared. Third choice, maybe I am not sure. So will you be willing to ask about suicide? Yes, if it helps. No, I'm scared. Maybe I am not sure. So please share with us your answer. Click in your answer if you are on Zoom, and type in your answer if you are on Facebook Live. We would love to hear from you. So the winner here is yes, if it helps. It's 91%, and very few with no, I'm scared, and very few with maybe, I am not sure. This is our last poll question. Feel free to answer. To whom do you refer when you have a teen with mental health concerns? Is it a mental health professional? We have psychiatrists and psychologists. Then we have your family doctor or your pediatrician. Then we have guidance counselors from the schools. And lastly, I do not have access to any of these. I will repeat. To whom do you refer when you have a teen with mental health concerns? It could be a mental health professional, a psychiatrist or psychologist, a pediatrician or a family doctor, a guidance counselor from school, or I do not have any access to any of the above. Please share with us your answers. So click your answer for Zoom or type in your answer for Facebook Live. So majority answered mental health professionals, psychologists, and psychiatrists. I will call now back our speakers, Dr. Tasha and Dr. Vanessa. Please join me for the open forum. Welcome back to the two of you. So now I will open our Q&A to start answering our questions. We will answer as much as we can with the given time. So my first question is, how do you manage adolescent patients who are suicidal? Do you immediately refer them to a child psychiatrist, or you start them immediately with meds without referring them? Dr. Tasha, you may start with your answer.
Okay, actually, it depends on the case. Because I mentioned earlier, right, that not all suicidal adolescents do want to end their life. Okay, so it depends on the severity. So usually, primary care physicians are supposed to be trained how to deal with patients who are quote unquote suicidal. Okay, so first you really have to verify, are they really suicidal, or is or how long has it been ongoing, or what are the other factors that are in the case, right? Are there any comorbidities? Like, does the patient have other um, illnesses, like the patient has ADHD, or the other has other mental illnesses, or other organic causes of the illness? But most of the time, as like us adolescent medicine, we do actually screen adolescents we see. So we identify some of them who are quote unquote suicidal, but we don't automatically refer all of them, especially if we know that they have the mild cases or they're not really intending to die. They just want to talk it out. They can actually be resolved just by doing psychoeducation involving the parents, or just giving them ideas about their situation. That can already help. But of course, for severe cases like those who already have had, or those that we already see in the emergency room that literally tried to take their life, we do refer them to psychiatrists. And again, depending on the situation, if they do need medications, we start them with medications. If they do need psychotherapy, we start them with psychotherapy, or both.
Okay. Dr. Vanessa, is there anything you can add?
Yes, I agree with Tasha. However, if the adolescents are really suicidal, we don't take any chances. We really admit them immediately to the emergency room just to make sure that they are safe. Because we don't want them to do something that's irreversible. We want to pull them out and help them and keep them safe. Thank you.
So, yeah, so safety is still our first priority, especially for those suicidal cases. So our next question is, what can be done if at times at least 3 of the red flags are observed in a teenager, but the person is unwilling to seek help? Now, I will relate that to a actually related question from Facebook Live. So my additional question is, what if a child who does not want to share to her parents but would rather talk to her friends? Is that fine as long as her friends are her support groups, her support system? In that case, how can parents support her if she refuses to help? So basically, you have a teenager who actually who refuses to seek help or tell her parents. What will you advise for these parents or these teenagers?
First off, even you don't need 3 red flag signs. Even if there's just 1 red flag sign, or you're really bothered that there are some ongoing changes with your adolescent, please, please, please feel free to have them consult a physician. Okay, at least we can screen and make sure that everything is really okay. Because again, part of being adolescents is they're really not close with their parents. Okay, they won't really volunteer to you information, and they won't really tell you, okay, mommy, I think I'm suicidal. Okay, especially parents. Okay, they really quote unquote hate parents during this time. Okay, they're against parents, and again, it's part of their development because they're trying to find their identity. They're trying to tell you that I can do it by myself. I'm on my own. Okay. Now, one important thing, very important for adolescents, is communication. Just really being available for your adolescent and just giving the environment that you're really willing to listen and that you're there and available would be very helpful for them. Okay? Because again, they won't come to you, but knowing that they can actually come to you, they may come to you. So you just need to open that communication between them. And it's okay for you. That's why I mentioned earlier, it's okay to ask about if they're suicidal or not. Because if you are already seeing changes in your adolescent, go talk to them. Start the communication. Tell them that you notice something's going on, or you noted that there are some changes that you can notice with your child and then ask if you can help and how can you help. I'm just a bit worried about if they're gonna tell their friends, because most of the time, of course, they would really tell their friends, but sometimes it's actually their friends who may encourage them na, okay, you want to kill yourself, okay, go ahead and kill yourself. Because again, they're also teenagers. So their brain development is not as fully developed. So if for them, it's actually exciting, to kill yourself or to see your friend who will kill yourself, they may actually encourage that friend, you know. So again, it's very important for the adolescent to really talk to um, reliable adults, parents, even other, not necessarily parents, even other relatives, or if you have their teachers, their guidance counselors. There are some adults who can actually help them.
In relation to that, we have actually someone who mentioned about guidance counselors. We acknowledge the role of that guidance counselors actually can actually help in in mental health conditions. They're actually part of the mental health team. So I would like to invite Maria Rosana Dagyo, if you would like to share with us your experience as a guidance counselor. Is she here? Okay, maybe later on, but we acknowledge the role that guidance counselors play in the mental health of our adolescents. Thank you very much for all the help that you have provided with them. So I'll move on to the next question.
Margs, before you move on,
Yes.
I want to share something.
Okay.
I think it is very important also that parents are given proper education as well as teachers, no? Because sometimes, even if the adolescent is the one who wants to seek help, it is the parents who are afraid of the stigma, no? So sometimes sila yung parents yung parang hesitant, natatakot, ayaw mag-consult with a psychiatrist and have their children labeled as ay nagkonsulta yan sa psychiatrist, ay may problema yan. So we really have to educate our parents, no, that it is okay to take medications if needed, plus they have to give support. So the parents themselves or the family should be the one who is supportive talaga. And also taught the warning signs para ma-direct to the guidance counselor and the school doctor, and the parents are alerted. Thank you.
Actually, that answers one of the questions about are there basic techniques available for children, youth, or parents if they have not access to any proper medications. So actually, you already answered one of the questions. So I will also again invite Ms. Dagoy if she's willing to share about her experience as a guidance counselor. Okay, if she is not available, I will move to the next question. Don't you think it is ironic that we advocate for taking care of our mental health, but medications and therapy are too expensive and most of them are only the rich can afford?
Well,
Can you
it's
comment?
true that some of them, that's why again, the treatment is actually based on case-to-case basis. Okay, so if, for example, there's no therapy available in your area, there are other help that can be provided for that adolescent. Okay, but it's somewhat true that, of course, medications are really quite expensive. But that's why we also have some help. If there are some free clinics like the ones mentioned by Dr. Vanessa earlier, and at times some of the medications are also covered either by the hospital or by the clinics, or if there are some samples, you can also take that. But I agree, it's really ironic that we want to promote it, but let's hope for the best. And at least right now we have the mental health law, so hopefully it will, really improve the management and treatment of our patients in the hopefully months or weeks to come.
Okay, thank you. Dr. Van, would you like to add?
Yeah, Marga, actually, I have some adolescents who request for a medical certificate for a PWD card just to have a discount in their medications. Some parents don't like because they don't want their children to be labeled as having a person with a disability, but actually being practical about it, no, para lang makatipid, para makabili ng medications, no, so we support it. And for consults, because it's also quite pricey po sa private clinics, you can access the help from the PGH Bayanihan Hotline para po free yung consults with a psychiatrist or with the adolescent medicine doctor. Actually, we work hand in hand. So pag nakita ng adolescent medicine, since our clinic is every day, we refer them to psychiatrists, no, or give proper advice naman. In PGH, there's a medical social service, so they might be able to provide some medications or through other fundings, no, yun, because we want the treatment to be continued, no, kasi hindi po pwedeng basta i-stop yung medications. The psychiatrist will be the one to titrate the medications pag pwede na po. Thank you.
Thank you. So this is the next question. There are some suicide cases of students reported connecting it to the new education system due to the pandemic. DepEd firmly denies the issue. Are there actions made by you or your good office to address this issue, even if the victims are gone? Is there a support system for them or for their families? So there are really truly there are effects of the new system of education, and some of them are still adapting to it. Dr. Tasha, would you like to share?
Actually, true enough, this pandemic caused this change in their educational system, and it's causing a lot of stress with their students. But as for our society, we're actually working with DOH, with Santi also, to help some of the teens, cope up with the stress of this. But it's not as big yet, And again, most of the time we just do see adolescents individually if they do have concerns. But right now, not really as a big DOH thing that can read, or big DepEd thing that's reaching out to the schools or different areas. But we agree that, again, there are a lot of factors that can cause mental health, and this change in schooling is a very big factor for our adolescents, actually.
Dr. Van, would you like to add?
So the Society of Adolescent Medicine, working with the Philippine Pediatric Society, have actually set up in the past few years the task force for mental health to teach general pediatricians and physicians on how to handle such cases, to look at get the warning signs and be able to refer. So the basic things like such as education has been laid down already. But I hope also that the schools will be more proactive, like in some private schools that I know their guidance office has been having a series of webinars for the parents, and also training their teachers to be able to identify students who need more help. And some schools would actually provide more accommodation for these students. Like yung iba, hindi na sila nag-join sa face-to-face. It's more of asynchronous tasks so that they have more time, o kaya they adjust the schedule of the deadlines to accommodate these students. And still, I'm promoting yung 155-200 na PGH hotline so that we don't want to lose our adolescents. Sana early on pa lang makapag-seek help na yung teenagers themselves, because it's a free call naman. And the doctors will be the one to call them for the consult. And our parents also can ask for help para we can do something early pa. Kasi pagka matagal na, mas mahirap i-pull out pag ang tagal na ng depression. So we want them not to worsen, not to do something irreversible, but to catch them early. Yeah, thank you.
Thank you. So our next question is, what's the difference of resilience and adaptability or adjustment disorder or adjustment? How can we build resilience in dysfunctional families, absentee parents, example, parents who are OFWs? Dr. Van, you may want to answer this one.
Okay.
The difference between resilience and adaptability.
Okay. Actually, so resilience is more of an umbrella term and part of it is adjustment and adaptability, which would mean being able to cope with certain problems, no, that come along the way. But resilience is a bigger term that would include their personal characteristics, how they deal with problems, having more positive coping strategies. So instead of adolescents who have problems, they would immediately resort to cutting themselves or hurting themselves. You want to teach them na, ano ba yung problema? To problem solve properly, ano ba yung naging problem? Maraming masyadong homework, baka kailangan natin mag-proper time management, list down what you have to do, list down everything so you're not thinking of them, then prioritize. Maybe the ones that need to be submitted tomorrow, yun ang i-prioritize natin, tapos yung pang next week, unti-untiin natin. So sometimes our adolescents just need this guidance, no? And it would really mean so much for them if they see that an adult is caring for them. So resilience is a bigger term. And yeah, Marga, it's really a concern for our Filipinos, no, Filipino families, because many of our parents are OFWs, especially the mothers, no. I found out in one of the studies that I read in a journal na it is true that being happy is easier to achieve sa families na intact, no, na nandyan ang parents. However, the time or the duration that the mother or the parent is away from the children or from the family still builds resilience for them, no. Mas mahirap maging happy kasi wala physically, pero the resilience doesn't change, no, and they look forward to being with their family back, no. And this is one of the advantages of having technology, no, na as compared before, pag OFW ang parents, talagang letter writing, but now it's more possible na everyday you communicate, you chat, you do video chat with your parents, no. And as I mentioned in the talk, having at least one trusted and caring adult would be enough to make an adolescent or a child resilient. Doesn't have to be a parent. No? So even if the parents are away, the fact that they are trying to reach out with their adolescent children or their children would make them feel resilient also. Thank you.
Tasha, would you like to add?
Actually, Van already mentioned it.
Okay.
Yeah,
Okay.
so it was to point out, no, as we just watching mention, no, doesn't need to be like the mom or the relative. Minsan, just a friend or a kuya, no, or tita or lola for most of our cases. That can really build resilience among our adolescents. Okay, again, multifactorial kasi siya. So just because umalis yung mommy or wala silang OFW yung parents, that doesn't mean agad na magiging sobrang at risk niya siya for mental health concerns, no. But just one adult, no, can already build resilience sa adolescent natin.
Okay, so actually that also answers one of the questions posted here, how to teach resilience to the digital generations. Actually using social media to communicate with your parents, you can help teach your adolescents develop resilience through communication and using these social media to communicate with them. Now I have a next question from Facebook Live. What if the mother is showing depression? The child is the one hugging the mother when she is crying. What will be the effect on this on the child or the adolescent? So yung mom ang may depression, how can this affect our teenagers or the children?
Actually, lalo na kung kailan nag-start yung depression. Kasi I mentioned earlier, if actually before pa lang na nagbubuntis si mommy dun sa anak niya na meron na siyang depression, that can already be a risk factor. But more so now, na nakikita nung mismong bata, yung depression ng mommy niya, no, that can actually be very stressful also for the child. Okay, so again, we can't help our kids if we can't help ourselves. Okay, so first and foremost, we also have to take care of our mental health. Okay, because we don't expect our teens to really take care of us when we can't even take care of ourselves. Okay, so very important, kailangan nyo ring alagaan yung sarili ninyo bago pa kayo mag-alaga ng mental health ng mga anak ninyo. Okay? Kasi makita pa lang nila na nasistress kayo, na umiiyak kayo, that can already be very stressful for them. But again, if the child is resilient, that can actually be a good foundation para maging resilient din yung adolescent. Okay? But again, that by itself, that's already a risk factor for the adolescent.
Okay, thank you, Dr. Natasha. Okay, Dr. Alban, would you like to add?
Okay, so as mentioned by Tash, self-care is very important, not just for our children, for our adolescents, but for us parents, no? Sometimes you also have that parang fatigue, no? Especially dahil ang daming online classes, ang daming kailangan gawin. There's no boundary between work and home anymore, no? So we have to really be mindful and take care of ourselves para maalagaan natin yung ating teenagers. And modeling is important. So as mentioned, pag nakita ng adolescent, ganyan pala si mommy, pagka faced with severe problems, sinasaktan niya yung sarili niya, tapos they would think that it's acceptable. So we have to be good role models to our children also. And yun, pag ganun yung parent, then siguro we can call a tita to help the mother, no, para mag-seek ng consult, no, so that we can also assist the mother.
Okay. This is a question for Dr. Vanessa. How do you build resilience when all or almost of the risk factors for building resilience are absent in the cases of abuse?
Okay.
So, Dr. Van.
So in cases of abuse in the PGH Division of Adolescent Medicine, sa OPD, meron po kasing adolescent clinic doon. What we do is, well, first and foremost, we refer muna to the Child Protection Network to be able to handle the case, no? So kung yun yung pinaka-concern nila, we don't ask the history anymore because it will be relieving what happened. We refer muna to Child Protection Network. When everything is okay, then they refer back to us to handle the psychosocial concerns, no? And the doctor goes through the different questions. If you have heard po of the psychosocial risk assessment or the HEADS questionnaire, so we ask about the home, about education, any eating disorders, activities, drug use, sexuality, suicide, safety, and spirituality, or asking about their coping mechanisms. With asking those questions, you would really be able to identify what are the protective factors of the adolescents. Even if it seems that they don't have any protective factor, I'm sure we will be able to identify one, no? And we have to really tell the adolescent na ito yung mga good things mo, good traits mo, no, ang nakakatulong sa'yo. And we also identify the risky behaviors so that when we have identified the risky behaviors, we can address them one by one. In the Child Protection Network, there's also the psychiatrist, no? So it will be a big help that we work together, no? So it's not just a one-time consult, no? Pag nag-consult sa psychiatrist or adolescent medicine doctor, hindi lang isang beses. It would be helpful kung may regular consults. For example, we see the adolescent today, then we refer to the psychiatrist. Kunwari, wala namang suicidal plan, no? Then after 2 weeks, you can follow up the adolescent so you can see what has improved, no? At ano pa yung mga, parang hirapan pa rin siya sa school, hindi pa rin nakaka-schedule ng homework very well, kaya laging natatambak. Then maybe you really have to to sit down with the adolescent and really write down ano ba yung mahirap na subjects, ano ba yung subjects na okay lang, ilang oras ba yung dapat na gawin. So you cannot solve all the problems of the adolescent in one sitting. You have to make several consults with the adolescent and the parent because their parents are our allies, partners natin sila sa kanilang pag-improve or paggaling.
Thank you. I only have time for one more question. In one study, children in foster care were almost 3 times more likely to have considered suicide and almost 4 times more likely to have attempted suicide than those who have never been in foster care. How can we prevent suicidal thoughts among adolescents in foster care or temporary shelters? Dr. Tasha?
Actually, as what Mom Van just mentioned, no, just building resilience, no, just finding what the adolescent really likes, you know, and identifying what are the things that would actually interest them, and not just, alam mo yun, parang hindi lang tayo mag-focus na, oh, nandito ka sa shelter, ito yung problema mo. Imbis na i-bombard natin sila na yun yung pinaka-issue nila, no. Try to identify where they're good at or what they enjoy doing. Tapos doon natin ilalagay yun. Kasi naman, not all adolescents naman in the foster are really suicidal. I mean, they are more at risk. Just the fact that they are in the shelter and the reason why they're in the shelter, diba? They're abandoned. So that already is a risk factor why they are more prone to have mental health concerns. But as Ma'am Van mentioned, no, there are still good things in an adolescent. So yun yung kailangan nating mahanap. For example, do they enjoy playing music? So you let them play the music. Or you can give them instruments to play with. Or are they good at cooking? So you parang i-focus natin and i-build natin yung confidence ng adolescent na parang kahit na nandun sila sa shelter, hey, I'm good at something. And I can nourish this talent or this thing that I really enjoy doing. No? So hindi naman puros bad lang yung napopokus. And of course, giving them love pa din. Diba? So of course, meron naman ng mga foster parents, no? Just the fact that they can actually get love, no? Minsan kahit simpleng touch or hug, very important pa din ng language of touch, no? Para sa adolescents natin. No? So just giving them the love and the care that they need, that would already give them a bit of hope and hopefully build their resilience.
So resilience and a loving heart is still the key. Dr. Vanessa, is there anything you would like to add?
Yes. As mentioned, yung positive discipline kasi is very important. Baka yun yung kailangan din ma-adapt ng foster parents or in the foster home na attitude. No? Minsan kasi na-label sila agad or they are treated in this way, na pasaway, which should not be the case. No? We are the protectors or the allies of our adolescents. So in positive parenting or positive discipline, no, para mas generic, we focus on empowering them, encouraging them, and highlighting on the mutual respect that we have for the adolescent and that they have for us. No? If the adolescents are in a foster home, no, or in a temporary shelter, usually po may yung mga social workers, they bring the adolescent to the like PGH, adolescent clinic, yun yung sumasama without the parents, no, para mabigay din yung not just the medical aspect but also the psychosocial aspect. Minsan yung pakikinig lang sa kanila really important, no. In the adolescent clinic po kasi at the starting format, the social worker or the parent or the person responsible is talking with us, with the adolescent. At the middle part of it, pinapalabas po namin para usap yung adolescent with us alone, no? Tapos at the end, we call them back, no? Para may respect then and empowerment of the adolescent, no? So because of the pandemic, at wala naman tayong OPD, limited yung OPD sa PGH, so call na lang sa 155-200 para mabigay natin yung nararapat na service for our teenagers. So we just have to change our frame of mind and approach to our adolescents. Minsan hindi madali, Marga, di ba? Pag nawawalan tayo ng patient.
Okay. Thank you very much to both Tasha and Dr. Vanessa. You learned so much. I really love learning with you and from you. So we learned about resilience and how to properly manage suicidal patients. So we would have loved to answer all your questions, but we really don't have enough time for them. So for final, do you have one final advice for the patient, for the parents and guardians and adolescents? Dr. Vanessa and Dr. Tasha, would you like to share final advice?
For me, siguro just enjoy their adolescence. You know, if we're very fond of our kids na ay, ang cute-cute nila, no, try to, again, as Ma'am Van mentioned, no, just change our minds. No? We really need to appreciate and see our adolescent as an adult we need to appreciate them that they are building their own identity. So we must enjoy their adolescence as well. And one very important thing, very important talaga, communication. Okay, so try to reach out, listen, and talk to your adolescent so that, again, we can build resilience all together. No? And we're all in this to help our adolescents.
We are all in this together. Dr. Vanessa, anything else?
Yes. My final message is that as parents, teachers, social workers, doctors, and advocates for our teenagers, we have to be respectful of them. We have to be responsive to their concerns, to their needs, to be firm with them, but to be warm and affectionate, and have that positive regard to our teenagers and never to be judgmental. Maraming salamat po.
Okay, thank you. So adolescents are still in a tap potential, so we have to still care for them and help them build resilience. Thank you very much, Dr. Vanessa and Dr. Tasha, for sharing your time, knowledge, and expertise with us. So
Welcome.
thank you to both of you. So this is the end of our session. Thank you very much for all of those who participated.